My name is Dr. Glenda Cardillo, Acting Physician General for the Pennsylvania Department of Health.
Dr. Cardillo says getting organized in 2013 can help lead to better health.
My recommendation would be, first of all, is to schedule a physical exam. Making a physical exam is important because you learn some important numbers such as your blood pressure, your weight, your blood sugar level, and your cholesterol level. Also an eye exam. Patients who are between the ages of 18 and 60, the American Optometry Association recommends scheduling an eye exam every 2 years. And those that are 60 and older, an annual eye exam is recommended. The main tip that I would like to get across is to take your planner with you to the doctor, and that way when you're there you can schedule your appointment before you leave for your next appointment. Some other things that can be thought of to do would be to schedule a pap smear and a mammogram. Also, I would recommend, if you're 50 and older, is to schedule a colonoscopy.
Dr. Cardillo says getting caught up on vaccinations is also important.
The Tdap vaccine, which is a tetanus, diphtheria, acellular pertussis vaccine. Basically, you can prevent the spread of whooping cough or pertussis to those who are too young to get vaccinated. And then you can ask your physician for other vaccines to make sure you're up to date. When children start middle school, they have to get like the meningococcal vaccine, the Tdap vaccine. There's also an HPV vaccine called Gardasil that's out there. You can discuss with the children can discuss with their parents if they're ready to do that at that point. Some other vaccines are like the shingles vaccine is for patients that are 60 years old and older. I would recommend getting that vaccine as well.
Dr. Cardillo also suggests getting organized around the house.
One of the main things I think that should be done is to clean out your medicine cabinets of any expired medications. If you have trouble finding out how to dispose of the medications, you can call your local pharmacist. Some of the communities have take-back programs as well to take back the medications that have expired. If you have an elderly parent, you can go in and ask them if it's okay to go in their medicine cabinets and read for expiration dates and dispose of them properly. I would recommend going through your refrigerator and reading the expiration dates on everything in your refrigerator and discard anything that's expired. Also, it's important to cut up fruits and have them on eye level in your refrigerator, so you're more likely to grab a piece of fruit. If it's already chopped up and cut up for you, you're more likely to eat that instead of other things that are easier to grab in the refrigerator. It's a good idea to have posted on the refrigerator or next to the phone any type of emergency numbers that you may need, especially the parent cell phone numbers, the fire department number, and also poison control numbers. You can have an emergency bag where you have a few days supply of medications. I would recommend doing that to have, so that when let's say you have to evacuate because of flooding or things like that, you can carry this one bag with you and have a 3-day supply of medications, especially for the elderly who are on lots of medications. Just keep a 3-day supply in that kit.